My name is Sharon Sandman with Native American Producers Success Project. Welcome you all this evening to join our calf weaning presented by Dr. Marcy Ward, New Mexico State University Extension Livestock Specialist. At this time, I will give the floor over to Marcy Ward.
Thank you, Sharon. So, welcome everyone. I appreciate your time this evening, and I once again appreciate the invitation from the NAPS group for helping participate in this great program. So tonight we will be discussing weaning, but in order for weaning to be successful, it really needs to start at birth. So I'm going to kind of go through how a calf can build its immune system to be more healthy at weaning, to have better performance in the feedlot and attract buyers for your calves because they know they'll do well. So if you look at these two pictures, we have quite a difference between animal type. And buyers truly do look for uniformity. They don't want to have to do big sorts, and they know if the animals are uniform in appearance, they'll very likely be uniform in performance and health. If there's a wide age range in those calves or a wide size range in those calves, there's a lot more at question on how they'll do. And so it can help build a relationship with buyers. It can help improve maybe getting the optimum price for your calves as you continue to generate a more uniform group of calves. Okay. So selection, I'm not going to touch on this too much, but it certainly does play a role along with good management that can help improve that value through breeding and being particular of the types of bulls you want to use on your cows. You can really clean up a lot and make a uniform set of, if your cows aren't really uniform, you can clean a lot of that up with a good bull. With good genetics. So putting those two things together can really also enhance the value of your calves. So I sound a little bit like a broken record, but when you put everything together in terms of management, genetics, and the like, the goal is for uniformity, obviously good growth potential, health, which is what we'll talk about tonight, but it is an indication of management. It's going to reduce the risk of on the buyer's side, and on your end, you can maximize your profits because they want the same thing. And then at the end of the day, they want to know what they can make the most money on. That said, if the calves perform well, they're willing to pay a little more. Okay. So as you look at these two pictures, again, really in terms of genetics, fairly similar, less uniform in group A, but they went through a different weaning program, in my opinion, than group B. Group B looked to me to be healthier, more ready to start on feed, lower risk, because you see some calves here that are already on pen A or group A that might not be feeling too good and won't take much to get them very sick. So pretty similar in genetics, you know, English and maybe a Charolais cross, but management kind of dictated how they're going to do. But like I said, it all starts at birth, regardless of your genetics. Colostrum is the first introduction of the immunity to that calf. And a lot of it is how that calf is raised in utero. They just don't have a lot of immunity passed through the placenta versus other species. So when they hit the ground, they're very vulnerable without getting that first milk that's got immunoglobulins that help boost and grow the immunity in that calf. If the calves don't receive colostrum for whatever reason, that's pretty well a death sentence for those animals. They just can't cope. Any small insult will make them very sick. And we also know through extensive research that a cow's body condition is directly correlated into the quality of colostrum she'll produce. So here's what happens, and you have a fairly short window to get that colostrum effectively into that calf where they can absorb it. These IgGs are very large proteins. And so when the calf is born, the gut wall is fairly porous, so it can readily absorb these big proteins, and so they can get into the bloodstream and start to grow their immune system. But that only lasts about 24 hours. So you can see here, you can measure it in the blood of the calf, the level of these IgGs, antibodies, go up exponentially right after birth, but being able to absorb drops exponentially. And so too, in the cow's milk, there's a point in time she just doesn't have any. So for dairies, for example, they really don't want colostrum milk to sell. So they don't sell any milk from a freshly calved cow for about 3 days until they clears all that colostrum out of her system. So here's a graph that shows what the serum IgGs in those calves are from cows that were thin at birth. And a body condition, if you remember from some of my nutrition references, body condition score is from 1 to 9, with 1 being very emaciated and 9 being excessively obese. We don't have data on those, but we do have body condition 3, 4, 5, 6, and 7. And you can see body condition 5 on up has a lot better concentration of IgGs for that calf, where the calves born to thinner cows were far lower. The other thing is calf vigor, and this goes to health as well for that calf long term. There's a direct correlation with body condition and the time for that calf to stand and get that very important colostrum in them. But at the same time, most cows like to calve in the middle of a storm. This data is from heifers, but you can see on those thin heifers, it took their calves almost an hour to stand. And if you're in a storm, that's pretty well a death sentence for those young calves. Where if they were in better condition on the cow side, those calves will stand right up and get to nursing. So monitoring body condition at weaning is a good way, on your cows, is a good way to do that. You don't have to be fancy with a 1 to 9 scale. You can keep it fairly simple, with 1 being very thin, 2 being average, and 3 being excessively fat. But you want to pay attention to this throughout the year. Easy enough to do. If you're going out, putting out mineral or hauling water, or whatever the case may be, and or feeding in the winter, maybe a good 75 to 80 days prior to calving, when your first calves typically hit the ground, you'll want to kind of make sure where you're at body condition, and you would need to adjust accordingly. Obviously, if they're fat, which is possible, you can cut back on your supplementation. But if you're in this zone, that's kind of a red flag. You really need those cows to ramp up on their body condition, because once they calve, their nutritional requirements continue to go up. And like I said, that link between colostrum quality and body condition is so important. You want to make sure that those cows are in a good shape to be about here at calving. So from a management standpoint, the first opportunity to continue to boost the immunity of those calves is at branding. We are a branded state, so about 3 months in after calving is started, most people will start to brand their calves. And also, since you're getting your hands on them, you can also start that vaccination process. Unfortunately, it's really hard to minimize stress. There's things you can do, and we'll talk about it, but this is a very high stress time for cows and calves, because this is the first time in many cases, they've even seen people. And then they're pulled away from mom for several hours. And then they are introduced to horses and people, and these are all new things. So stress can really wreak havoc on the immune system, and also ultimately affect how good the vaccine is utilized in the body. So, like I said, some of the things you're dealing with: separation. Crowding is a stress for these animals. They're used to being out in open country, and you bring them into a pen that, we take it for granted, but that really rises the stress level in these cows and their calves. Whether you do a calf table or you rope and drag, again, another stress. Castration, dehorning, another important thing that we do from a health standpoint, but that just adds to our list. Along with the vaccination. And this time of year in New Mexico, Arizona, we do see heat starting to pick up in May and June. So heat stress can also add to that. So the best thing to do is fewer people that are very good at their job can make this process go as quickly as if you have a bunch of people. And I know branding is a very social time. It's where neighbors help neighbors, but that's something to keep in mind in terms of really helping these calves out, having fewer people that are well-trained, do the actual handling of the cattle, and keep it slow, keep it quiet. Facilities can be a big thing. If the facilities aren't quite right, where they can easily escape or get hung up, or it's very loud, that actually contributes to stress as well. And when I say less tools, I predominantly mean if you're taking them through the chute, hot shots. 9 times out of 10, you don't need a hot shot to get these cattle to move if you're standing and moving in the right direction. So the earlier you can castrate your calves actually reduces stress, and has no impact ultimately on performance. A lot of times people hold off on castrating until weaning, thinking they'll get a little extra gain on their calves. But you can see from this data, that's not the case. And in fact, the non-castrated calves, the older they get, the more stressful this procedure is, and they go backwards on you pretty significantly. And so that's why you'll see, if you sit in the sale barn and you see intact calves come through that look great, but they're intact, they get heavily, heavily discounted, because the buyers know and the feedlot owners know, or if they're going to grass, whatever, that if they're going to have to do the castration, they are going to have a high stress situation on those animals, and they're going to have a high risk for sickness and death loss. So there's many tools of the trade. And like I said, doing this on younger calves, the better. And you want to incorporate a tetanus program as well in this. So the combination of someone who's skilled at this, along with a tetanus vaccine, a lot of your 8 ways contain a tetanus booster, will help reduce the incidence of that. A lot of people do like the banding because it's quick and easy and bloodless. However, I personally prefer a knife, simply because if it's done right and it's handled well, it's a quicker heal time for those calves. And you know you've got 2 testicles. You don't have one slip out. Because if you were ever to compare a cut calf versus a banded calf, think about putting a very tight rubber band on your pinky finger and how much that hurts for a very long time. It aches and then it ultimately rots off, right? Well, sometimes one testicle will slip out of that, or they can get infected, obviously, the older they get. And so to me, using a knife, skilled person to do it, and keeping everything clean, utilizing iodine, sterilizing the knife in between with like a Clorox type product, or not Clorox, but like a disinfectant, can really help. Because this is what happens if you don't either do a good job in castration, or you don't get both. This is a calf we quote unquote inherited for a management deal. He was about 650 pounds when he came in, and one of his testicles had adhered to the side of the scrotum, and it would have been a surgery to get that done, fixed. And so and it was infected. It was just a bad situation for that calf. Okay, so horns obviously too are problematic, or can be. They're good for cows. I have no issue with cows having horns. It's a good defense mechanism. However, if you're going to be selling your calves, which you're going to ultimately sell, 85 to 90% of those calves, you're going to want to knock those horns off for a couple reasons. There's more bruising in these animals. They require more bunk space and management. And ultimately, they're probably going to get cut off at the feed yard. But again, when they come through, and if they've got horns on them, they're going to be heavily, heavily discounted, because the later you wait on dehorning, the more invasive that procedure is and the higher stress to that animal. In terms of nationwide, we do a pretty good job in the West of taking those horns off those calves before we sell them. As you go east, they don't do either castration or dehorning very well. And that's why a lot of those eastern calves don't sell well, is because they're high risk for those reasons. So this just shows you if you have horned cattle and you can get a button out of those calves by the time they come into the branding pen, and use a spoon or one of them burning deals to knock them off, that you can see it's just still within the skin. It's not too invasive. There is blood, so you do need blood stop to manage that. But it's still in the, very much on the surface. You wait until fall, or until it gets even an inch or 2 outside of the skull. The reason so much blood is an issue with dehorning these types of calves, it has now become part of his sinus cavity. This is sinus, and this is bone. And so all of a sudden you're dealing with a much more invasive procedure. Okay, so we're going to shift gears now and talk about why we vaccinate. It's also to kind of offset some of these stressors like castration and dehorning, but because when they have stress from those type of procedures, their immune system goes down because of the stress, which makes them more vulnerable to other insults of disease. And so eventually, without vaccination, immunity sort of plateaus, right? So this is just the basic what you get from your colostrum. But if they're introduced to a new disease, particularly when they get into confinement, that risk of them actually catching that disease goes way up. So this is what happens in the course of a year for a cow, or a calf, I guess. So there is some innate immunity. You give a vaccine to the cow to a certain extent, very limited, but to a certain extent, she'll pass some of that on to her calf, depending on the antigen you're vaccinating for. This black here indicates the passive immunity from the colostrum, right? So they get a boost, but it only lasts for so long, and then it starts to go down again. But here with vaccination, we can help fill that gap and continue to improve the immunity of these calves long term, okay? So there's a whole host of protocols out there, lots of different types of products, lots of different companies that have various virus and bacterial vaccines. So we really encourage you to consult with a veterinarian in your area, because some viruses, some bacterial disease can crop up in regional areas that may not be all over. And if the veterinarians are aware of these, they can fine tune your vaccine program to make sure that you're covered where from those diseases that are a little higher risk in your area. So the protocol should contain both a clostridial, which that's your bacterial diseases, like your 7-way, or your black leg, your IBR, or not IBR, but your tetanus, your red water, or some of these bacterial diseases that can kill your animals very quickly, overeater's disease. So that's important, and we've been very effective in controlling those diseases through vaccination, and they're very inexpensive. The viral diseases typically cover a wide range of diseases for respiratory, okay? And there's a couple different kinds of vaccines you can give for the viral diseases that I'll talk about here in a minute. Now, there's a lot of vaccination programs out there that can offer some incentives. One of the things that buyers tend to like is if there is what's called a third-party verification, meaning I've seen a lot of guys go to the sale barn and the auctioneer will say, yep, they've had all their shots. Well, what does that mean? That doesn't really mean much to a buyer anymore, of word of mouth. Oh, you know, because for some that means an 8-way, right? We've covered 8 diseases. That's all the shots. Or, you know, if it's just one shot at a time, you know, one at weaning or one at brand, they don't know the history of these calves. They don't know what all they've had all their shots means. Where a third-party verification program gives that buyer a little more incentive. We have this program available through NMSU. It's called ACEs High. Here is the website. This is our general NM Beef website. We have a bunch of programs, not just the vaccine program, but a whole host of other programs found on this webpage. But look for ACEs High, and you can sign up. Typically, we ask that you sign up before branding, and you work with a county agent, a tribal agent, somebody that can turn in that paperwork for you. And then with that, we send ear tags that say that you are part of this NM or this ACEs High program that can help boost the value of those calves. I sat in on a sale. First year we had the program, and we had, I think, 400 or 500 calves to go through at Clovis that year. And immediately when those red tag calves came in, the price went up a little bit. So there's a little bit of an added cost to it with the tags, but other than that, it pays because you get a little bit of a boost in your cost of your calves, price of your calves, sorry. Okay, so I've talked about clostridials, I've talked about modified lives. The clostridials, again, are your bacterial, but modified live or viral diseases can either be killed or this version or chemically altered. The reason we really promote that all calves for their very first shot and booster get a modified live, okay, because it's the closest version of the virus for the body to recognize and respond to. The challenge, a little bit of a challenge with vaccines is all vaccines are sensitive to heat and light. These vaccines need to be mixed. This right here happens to be Enforce, which is an intranasal modified live, but you have to mix the 2 vials and then shoot it up the nose. This one is just a BRD vaccine. Again, you want to mix that before you administer it. And once they're mixed, they have a very short shelf life, only about 2 to 3 hours for them to be fully effective. So you want to plan quite well when you are using these products, because say you mix up a 50-dose bottle and on cow 30, you lose 20 of them for whatever reason, right? And it takes you a good 2-3 hours to get them back in the pen. And all of a sudden that vaccine's no good. So what I usually recommend for people, say you're doing 100 head, for example, in a day, plan out what you can get done in a few hours and then back off from there. So for example, if I'm pretty comfortable with the fact that I can get 50 done in a couple hours, then but I have 100 to do, I then will buy a 50-dose box, maybe a 20-dose box, and then a 10 and a few 5s, because you never know when something's going to happen, or all the cattle don't come in, or whatever the case is. You don't want to waste a full bottle of product once it's mixed, because it gets pretty expensive. You do also want to read the labels very well, as some of these modified live vaccines can affect pregnancy in the cows. So even if you're not giving the shot to the cows, the calves can shed particularly IBR, infectious bovine rhinitis, that will cause the cows potentially to slough their calves. So read the labels. A lot more products are on the market now that say specifically safe for cows. So you can either give it to the cow or you can give it to the calf, put the calf back on mom with no issues. But be sure and note that before you start using the products. So in terms of getting that second dose, and this is what we're dealing with COVID right now, and second and third and all that. One of the things that we know with these vaccines is we have a primary response that's quite good, but eventually it will start to drop down. And then that secondary dose within a reasonable time frame will shoot that immunity a little bit higher than the previous dose, okay? So it adds a little better protection if you have a booster. So most all shots do recommend that you have a booster program in place, and a shot at weaning, and then a shot again or a shot at branding, and then a shot again at weaning. Even though that's a little longer time frame, it still provides that added boost. A lot of these vaccine programs that I spoke of earlier require 3 shots, where you give 1 shot at branding, and then you would give 1 shot to the calves, put them back with mom, wait 3 weeks, 45 days, whatever it is, and do the second shot, and then wean. So they have our 3rd shot. So they have a total of 3 vaccines before they leave the ranch. So just a little bit on management itself. I think what happens in some cases that I've seen, I work, I'm the director of the Tucum Carry Bull Test, and we average about 20 to 22 producers a year that come and bring their bulls to the facility. And it's very similar to a feedlot. So these bulls have been out in open pasture, then they come into confinement, and it's high stress. The requirement is they are weaned, meaning they've been away from mom for at least 2 to 3 weeks. And then they're all managed pretty similar in terms of some of the protocols I'm talking about, but we still have issues with sickness, and it's always related to a specific producer. And it's not usually the same producer year in, year out, but I've noticed there's a very much correlation between producer and who gets sick. And I think in some cases, it's how the vaccines are handled, and not so much the management per se or the genetics, but it's just things can go awry, and maybe some things can be done differently to improve the efficacy of those vaccines. So the first thing that's really key in all vaccines, whether they the viral or the bacterial, the clostridials, keep them cold and keep them in a dark place. The light can destroy the virus or the vaccine. And then a warmth certainly, or rapid big swings in temperature will certainly affect that as well. Reading the labels to know what appropriate storage is. And then when you are getting ready for your work day, label each vaccine gun or syringe quite clearly, because some of these vaccines look very similar, and some of these vaccines offer different doses. And so if you don't have a good label on what's what, you could be giving double of one and not enough of the other, if that makes sense. So labeling is very key. And then changing needles frequently. So I love this picture. I use it all the time. I've probably used it in the last few sessions at some point with you guys. But so here's a new needle. First time in, you get some dirt and a little bit of a barb. Second time, more dirt, more barb. By the end, by the sixth time, you're dealing with a blunt object. Well, most of these syringe guns carry about 10 doses. And so I'm not suggesting you change a needle every two animals. That's expensive and impractical. But I guarantee you the last couple in that gun are going to be the ones that get the knots. And so what I really do recommend is changing needles between the gun, or whenever you have to refill your syringe gun, or if it's really taking a good push to get that needle in, it's time to change it. Okay, and that's usually before you refill the syringes, but for very minimum, change them when you refill the syringe. So there's one thing that can be a little confusing. You know, you go to the doctor, they'll swipe your arm with alcohol and they'll give you a vaccine, and they're doing that for, you know, cleanliness purposes. But if you think about it, that's just bare skin. There's no fur there. And one of the things that I've personally witnessed is blackleg of all diseases crop up in a fairly well managed herd. And after I got to visiting with these folks, they were disinfecting the area with alcohol before they gave the vaccine. Well, what ended up happening is they were effectively killing the drug before it even got in the animal. And so using good needles, you shouldn't need to disinfect, and you really can cause harm. Where it is very important to disinfect is if you implant your calves, or certainly if you're castrating, you know, you want to have some sort of disinfectant between anything that's going to potentially draw blood, because you can have blood contaminants, and that blood can be passed to a perfectly healthy calf and cause sickness. So do disinfect if you're implanting. Don't disinfect on regular vaccines. The other thing is don't mix medications with your vaccines, or certainly make one vaccine out of two, because they can combat each other to the point of being both ineffective. In fact, we recommend with beef quality assurance that you separate your vaccines a good 3 to 4 inches if you're going on one side of the neck, or ideally, I know it's not handy, but ideally you give one of the vaccines on one side and the other vaccine on the other. And then that will prevent cross-contamination within the animal, okay? Because you want to maximize the value of these vaccines and the efficacy of them. You cannot store, so if you have modified live that you've mixed up and you're done for the day, or the cows got out, or whatever it is, you ran out of daylight, you can't throw that in the fridge, you can't throw it in the freezer to use the next day, you're done. So it uses up, like I said, it's a very short shelf life once you've once you've mixed it. The Clostridials, on the other hand, the 7 ways, the 8 ways with the black leg and the like, those are a lot more stable. And so, yes, you can get those 50 dose bottles, and if you have extra left over, you can put them in the fridge, provided that during your work day they weren't exposed, got warm, or got exposed to daylight too much. I kind of talked about already, I usually get ahead of myself on a lot of these things, but don't mix too much of the modified in advance. You know, you don't want to say, well, we've got 100 cows to do, I'll just mix all of them up now so we don't have to stop and mix. You can't do that, because by the end of the day, the last bottle to be used won't be any good. And and everybody's guilty of this. I'm just as guilty. You get busy, you're in a hurry, which is, you know, it's really hard to tell people not to be in a hurry, because I'm just as guilty as anybody is to, come on, let's go, let's go, let's go. But in reality, you know, if you're good at what you do, you can go slow and be done in just about the same time. But one of the things that happens is open the cooler, shut the cooler, open the cooler, shut the cooler. And a lot of times that cooler gets left open. Well, every time we do that, we're letting cold out, we're letting light in, and we're losing some quality in those vaccines. They're coming out with more products all the time. And I don't think I grabbed a picture to put in here, where a lot of animal health companies have these special vaccine coolers now that are really great, because they have these spots where you can put your gun in. So even the gun stays in the dark and in the cool of the cooler. And you can label the guns, like the slot for the gun has a label, and then you can store the non-mixed product underneath. So they're really handy. They are expensive, but in my mind, they might be worth the money if you're going to work a lot of cattle. So where to give the shot? If you've gone through BQA training, this is a very familiar picture to you, the famous triangle in the neck. We go to the neck because it's our lowest utilized portion of the carcass. And so in front of the shoulder, above the jugular vein, and then below the top line of the neck, kind of down in that circle. And in those calves, you don't have really a big area, right? But ideally, you want to give all vaccines in the neck. And one of the things we know a lot of people do, because it's easy access, is they'll give at least one shot in the armpit. Unfortunately, guys, that's not really the best place to give a shot, because there's not a lot of vessels in that armpit. It is under the skin, right? But there's just not enough vessels to pick up adequate supply of vaccine for them to get the full dose. So that's why both that, you know, whether it's your 7-8 ways or your viral shots really all need to go under the skin up in this region. So this is something that I don't know how much you're aware of, but it can also add value in terms of maybe an incentive on or get a few extra dollars on your calves if they've been BVD tested prior to shipping. And this also bodes well for you on your replacement heifers. Okay, so it's called PI testing, and PI stands for persistently infected with bovine viral diarrhea. And it's an ear notch procedure that you can just put in a small Ziploc bag. Hopefully you're ear tagging your calves with some sort of identification so you know who's who. Also best if you know the cow's ID. I know that's not always possible, but I'll explain why that's important here in a minute. These are fairly stable, but I do recommend, put them in a cooler while you're pulling the samples. And then whenever you go to town, before you have them in the freezer, and then when you go to town, you can mail them then. And you would send them to the New Mexico Veterinary Diagnostic Lab for testing. So what is it? What are we talking about? So PI, like I said, is persistently infected of BVD, and there is a vaccine for BVD. However, a lot of times cows can become infected if they're not fully protected while they have the calf inside. And if they get infected while pregnant, the calf becomes a carrier of this disease. He may not show sickness, but he sheds the virus, much like our silent spreaders on the COVID. That's what these guys do as well. And so, so they're very much a liability in the feeding industry, because this is a highly contagious disease that can really, wipe out an entire pen of cattle pretty quickly. And so one of the things you want to do is at branding, pull these ear notches. And if you get a PI positive result, you need to then identify him and the cow, and then test the cow. So if the cow is negative, then just sell the calf, get him gone, because he's exposing all your other cattle to that disease. If the cow shows to be positive, that means she is a carrier as well, and she needs to go because she's just adding to the problem. So the other issue of not just respiratory disease in these cattle is they also will abort their calves or absorb their calves in early pregnancy. So you have a lower calf crop, and it's just a domino effect if you get an infected herd. And so it's really important that you monitor that. When we ran the grazing program at the Vias Caldera, we did PI testing, and we do it at the chicken carry bull test as well. And at the Via, every single year we would have positive cases. And so we really recommend, and then those calves and or cows would leave the program immediately. We have not had any positives on the bull test, but you've got to monitor to know what you have. So like I said, if you show when you get ready to market your calves and you can show that they've all been tested and they're all negative, you can get a premium on these calves, but there is a cost, obviously. It averages about $3 a sample, plus shipping to the veterinary diagnostic lab. But again, having that additional source of information is really important piece of information for your buyers. They'll really like that if you've taken that step. Okay, so that was a very roundabout way to get to the main topic of tonight, is weeding. But hopefully I established a foundation for you to make weaning as successful as possible. But just as with branding, it's the next most stressful time, particularly because these calves never get to go back with mom, and that stress is never reduced for quite some time. And so that is why a lot of buyers prefer that you wean the calves on the ranch and then they'll buy them from you because you get to absorb that risk. However, when they are ready, if they are kept at the ranch before, and fully weaned, that stress is a little lower than if you just what's called strip and ship and send them down the road. Okay. But it is a good time to boost immunity, and it is your payday. So it's very, very important. What do I think of the weaning plate? Hi, Marjorie. So Marjorie asked about the bumper. I don't have a picture of them. We can maybe look one up for people. The weaning plate is a bumper that you put in the nostrils of your calves that are forked, most of them, or they flats, and they can't physically nurse. And so that is one way that you can nurse or wean on the side of the cow. And yeah, there's some opportunity there, but you do need to watch the costs and if they stay in and all that. But yeah, that's a way that you can wean and put them back on the cow. Because really, by weaning, the cow's not milking a whole lot, but so they're not really getting much nutrition, more so than just companionship. So thanks for that question. Okay, so at weaning, again, whether you do a weaning next to mom, you want to give them that second shot, irregardless, is a benefit. So the other thing is to think about boosting immunity of your cows. And we do tend to take them for granted, but fall is a good time to offer those boosters, those annual boosters. They just need one shot of both the clostridial and the viral vaccines. There is some transfer to the calves, not a lot, but there can be some immune transfer in those pregnant cows. But again, you want to make sure that the vaccines you utilize are safe for cows. And the fall is a good time for pregnancy checking, giving them their annuals, and going down the road with them. So in terms of health protocols, you like I said, you have strip or ship, or you can retain them for 45 days. If you talk to buyers now, the ranch before they'll buy them, which is hard for a lot of folks to do. You'll have to really weigh your costs on that versus your returns. But think about, you're setting up your heifer's health as well long-term. So, selling at weaning, your vaccine protocols, you would want a broader spectrum viral modified, meaning it covers more sicknesses than just the 5. Okay. And then again, the 8 ways. And then reworming really is only beneficial to those that stay on the place. It's not, they're going to get vaccinated, very likely they're going to get vaccinated and wormed when they arrive at the next location. So from a cost standpoint, there's no benefit to worm those calves that are going to leave the ranch. So here's a fence line weaning option as well. You got to have fairly decent fences, but basically what you do is you park your cows right next to your calves so they can at least see each other. That's been a fairly common low stress weaning option for people as well, if you've got the pastures to do it. And then, like I said, when you're doing this to kind of keep them, you want to reduce your risks, right? And so if you want to ramp up your protocol to reduce your risk, that's a good way to do it. And in that case, I might worm all calves. And then this injectable mineral, I get questions on all the time. Multi-min is the product specific. And in this situation, when stress levels are high, there is some value there. However, keep in mind, they only really last on the outside, maybe 45 days, okay, before you would need to re-inject them to get that boost. So a good solid free choice mineral program can be as effective, but certainly if you've had issues with sickness in the past, an injectable mineral can be beneficial. So the strip and ship is the day you wean is the day they get loaded on the truck, direct off the ranch, or take them to the sale barn. But with balling calves, it's a high risk situation for buyers, and they tend to discount those calves a little bit. Where a VAC verified, we do have, and part of our VAC verified, this option. And so you might get a little bit of a premium out of it if this is a management choice that you would prefer. So keeping at home, like I said, 45-day minimum, but you need the facilities. It's ideal if you have some sort of way to introduce feed to these calves in a bunk line situation. So when they get to the feedlot, they go right to town. But keep in mind that you're assuming risk on sickness and death loss. But on the end of the day, you might get more value out of those calves. Again, I'd like to jump ahead of myself. So fence line weaning, low stress. You got to watch your pasture size, make sure you have enough feed for both. And it takes on average about 30 days to dry a cow off. We think they'll, take just a week or two, but really she doesn't become fully dry for a month. So the adjustment, separation, the balling, the pacing, you're going to lose a little weight in those calves, even in the fence line weaning. But in about 7 to 14 days, that should all settle down. There's your flappers, Marjorie. Low stress, but it does cost a couple bucks per nose. And again, the idea is they can't physically nurse, but they're with mom on a comfort level, but they're still going to have that separation anxiety when they are ultimately sold off the ranch. So that's something to keep in mind as well. They consider it low stress, but it's the separation component is what really causes the stress. Where in fence line, they'll pace that fence for a while, and then they'll just naturally drift off by themselves after a couple weeks. So full pasture separation, out of sight, out of mind. Again, that's no different than if they left the truck. The benefit is they are at the home place. They might be in some familiar territory. And so just that familiarity is going to reduce their stress levels. But you do want to keep them full. You will need to be pretty good about watching for sickness on a daily basis in these calves. They'll usually break if they're going to get sick about 10 days out from weaning to 14 days. You'll start to see them go backwards a little bit. So how are you going to manage them? Are they going to be on the grass? Ideally, that's the best. But if you do want to do some hand feeding, dry lot's always an option. It gives you some good marketing options too. You can watch the market, so a lot of calves hit the market in October, and that's when traditionally year in, year out, calves are the cheapest because it's simply a supply and demand situation. Where if you keep them at home and you're getting them through that weaning process, that market's going to respond a little bit down the road that you could get a little added value just in market change. So what would you supplement in these scenarios? You want a high digestible fiber, good quality hay, decent protein. These guys need about a 14% protein in their diet to keep growing. Low starch is really key so they can utilize the fiber part. And low starch would be like a distiller's grain. Corn is high starch. 2 to 4 pounds of supplement a day would be plenty. Cubes are a good alternative. Preconditioning feed. Both of these are decent energy, low starch options, but you do want to make sure it's going to pay. In the dry lot, again, they're going to need about 10 to 15 pounds a day to feed. And this time, with the drought and everything, that might be harder to get done in terms of availability. Corn is exceptionally expensive right now. So this is something you really have to pay attention to, the feed availability in the markets. But again, about a 14% with a good source of energy is what you want. If you're going to do a dry lot too, work with a nutritionist if you can, or someone like myself, or any extension specialist in cattle or livestock, or even at the universities should be able to help you with that. Oh, that's repeated. Okay. So immunity starts in utero. Keep that in mind, that if you want to set your calves up for success, you need healthy cows and good body condition and current on their vaccines. At birth, they'll get that dose of colostrum, but the quality of colostrum is driven pretty significantly by the cow's body condition. So you want to monitor that throughout the course of after you weaned. The modified live vaccines are highly recommended over the killed version. The killed virus vaccines are cheaper, but not as effective. And to introduce them at branding is the first step. And then following that with another modified live, and it can be a different product, that's okay at weaning. The weaning just improves that immune response and the performance of that calf after he leaves the place. But how you, whether it's at weaning, at branding, whenever these animals come in contact with you, how you handle them will have a negative effect on their ability to absorb those vaccines. Cortisol is a hormone that spikes during stressful events, and it hammers your immune response. So keep that in mind. And with that, now I'm done. So sorry if I went over time a little bit, but I think this is really key and important for good health in your cow herd and with your calves as well.
Do we have any questions? Now's the time for your questions to Marcy.
I have a question. What would you more suggest as far as weaning them off, the weaning plate or separation?
The weaning them off directly or weaning them at home? Is that what you mean? What do you mean?
Yeah, I mean, just what would be your most, what would you recommend, the separation or the weaning plate?
Oh, the weaning plate, sorry. So I think if you can do fence line weaning, I really like that because they're still next to mom for a few days, but then it's a very gradual and easy transition to being on their own. They will drift off eventually and go out looking for feed. And so when you're ready to ship those calves, they're, the ball is out of them. They've already known to forage for themselves. And personally, between those two, I prefer the fence line. Like I said, if you were to just move them to a pasture that's out of sight and earshot of the cow, that offers the same stress as if you were to put them on well, not the same, but similar stress as if you were to just put them on a truck and send them down the road, just because, they're going to pace for several days and they get no relief from that looking for mom because they can't find her, if that makes sense. So the plates have their place again, but when you get ready to ship those calves, they're going to go through that same separation stress as if you were to just strip and ship, in my opinion. So they'll eventually quit trying to nurse mom, but they're going to hang pretty close to her. So just from more of a companionship, safety, comfort thing. So.
Okay, thank you.
Mm-hmm.
Okay, do we have any other questions to ask Marcy? If not, we will move on to ending this webinar. We have Michael. Thank you, Marcy, for another very informative presentation.
You bet. Sorry, I went a little long this time.
Oh, that's fine. We enjoy listening to all the information you have to share with us. You know, some of it is like new to me, and just in awe.
Oh, yeah.
Yeah. So anyways, thank you so much, Marcy, and we'll go ahead and end our webinar here. Um, Make sure you all answer our questions at the end of this webinar when you sign off. Um, we are also on Facebook page, YouTube channel, and we also contribute a monthly newsletter. All my colleagues that help out in these webinars are Jesse Jem, myself, Sharon Sandman, and Jenna Johnson. We will have our next webinar on August 30th, or I think it's the 31st. But we will post it. I think it's the 31st. Anyways, it'll be on Navajo Nation drought vulnerability and mitigation efforts by Crystal Tully Cordova. She's a PhD major in principal hydrologist with the Navajo Nation Department of Water Resource. And that would be another webinar. And we invite you to join us on that webinar on August 31st at 1 o'clock. Thank you so much. Native American Producers Success Projects is a collaborative effort between Dene Inc., a nonprofit organization, New Mexico Cooperative Extension Service, and Dene College Land Grant Office. The project is funded by USDA's Office of Partnership and Public Engagement, Outreach and Assistance for Socially Disadvantaged and Veteran Farmers and Ranchers Program. The goals of the NAPS project is to increase the profitability and long-term sustainability of Navajo farmers and ranchers. To achieve their goal, activities in 4 key areas are being undertaken to improve Navajo farm and ranch operations, increase Navajo farmer rancher knowledge of and access to available programs and technical assistance provided by the United States Department of Agriculture, the Bureau of Indian Affairs, the Navajo Nation, the New Mexico Cooperative Extension Service, the Dene College Land Grant Office, and others. We also strengthen the organizational capacity of the Navajo Farmer and Rancher Congress to address the current and future needs of Navajo farmers and ranchers. We also facilitate Navajo farmers, rancher use of USDA's NRCS, FSA, and RMA programs.